Like all the great.
Okay. Can I just clean everywhere? Clean?
Mm-hmm.
Should we do 3 line or 3 line for the lower face? 1, 2, 3? Okay.
1, 2, 3.
Forward look. Okay, close your eyes. Smells bad. And cold. Just cleaning. So let's do the marking. So for the forehead, so draw midline, draw a line from lateral eyebrow, another one here. At the same time we have to avoid all the superficial veins. So from here, just 1/3 to maybe 2 there. I'll be just joining around there. So 1/3, just join the line. Now with this one, you can draw a line. Towards there. This side. Okay, so we did the marking now, so I'm going to do the entry point. So with the entry point, to get into the deep dermal layer more easier, I normally I just pinch and grab the skin and just penetrate enough so just the full verbal just goes in. That's it. One more for here. Just very superficially, that's all we need. Show me the other side. Yep, just press on that. Go. Right. Just grab the skin. First direction, just change the direction. Don't pull it out all the way because you might be getting 2 holes. That's it. And then just one more. Yeah, well, is good. Now we don't need the needle. Now I'm going to do the anesthetic. Just grab it like a pencil. Find the hole. Change the position. Go flat. Traction the other way. And then all the way through. All the way through. All the way through. So you can see the tracking. And because this is a curved area, make sure you advance it slowly. Feeling for all the tip of the cannula going over each resistance, and that's sort of the things you want to see, especially on the curved area. So I'll be injecting just the minimal amount per line. So it'll be 0.5 mil. Slowly, so a bit of stinging. That's it. Now I'm going to be changing the direction. I don't normally pull out completely. Just enough so the cannula doesn't bend. Okay, then traction, and then a bit deeper. Good. So you can glide it in. Easy. Bit of resistance there, so I'm just going to get over that resistance. And a bit of aspiration, and then another 0.5 mils here. That's it. grab like a pencil. I just found the hole. Go flat, parallel to the surface, traction, and all you need to is just glide it in, advance it slowly. If you meet any resistance, this is the control, and you just advance it slowly. Aspiration and another 0.5 mils. A bit of stinging. That's it. Now the other side. Yep, turn towards that. Good. So because when we're doing entry point, people can bruise around the entry point. So I wouldn't inject any PCL material, maybe 1 to 2 centimeters around the entry point. Just find the hole, flat, traction, and advance. You see all the dimpling and tracking going. That's what you want to see. Good. Aspiration, and then just 0.5 mils retrograde. That's it. I'm not pulling it out fully, but almost out, so we can change the direction without bending the cannula. Traction, and then advance. Traction, resistance there, so all you do is place your finger, go past that, and past that. Aspiration, and then another 5 mil, bit of stinging. That's it. And the last one for the forehead this side. Grab it like a pencil, traction. All you need to do is find the hole, just place the tip of the cannula, go flat, traction, then you don't need any other help. Good. Aspiration, and then I'll put the rest of the 0.5 mils. That's it. So she's all prepped up. I'll just get back to the other side. Now, turn the other way for me, Caroline. She's a leader. Okay, so I've got a bit of local anesthetic inside, so I'll just prime it a little bit. Good. So same way, this will be easier than injecting the local because we already made a created pathway. Sorry, clean. So sometimes if you can't find the hole, clean and just squeeze it, then you see where the blood is squirting. Yep, so I found the hole, traction, and then just see the tracking. If you feel way too superficial, press down on the tip of the cannula and just go slightly down. Good. And good. Aspiration. And just the 1/3 of the mil. No pain, right, Caroline?
Nothing.
Yeah. So because she was bleeding on that point, I'm not going to inject anything around the entry point, and then I'm just going to change the direction and then advance it again. You can see all the tracking. Good. Aspiration still. You don't want any, even a drop of any material getting into the blood vessel. So 1/3. That's it. Now the last one. Okay. Traction in the opposite direction and then glide it in on the same line as where the cannula for the anesthetic went in. Alright, just did it. I'm going to use the rest of it on the forehead. Good, this side is done. Now, Caroline, take it to the other side. Last one for the day. already primed. I use the same cannula because it's already primed, so we save 0.1 mil, so we have 0.1 mil more to work with. Okay, just find the hole, go flat, pull, and then just gently, you can see it progressing. That's perfect. All right, just the 1/3. That's it. Good, and then good. Now last one for the whole thing. Okay, just find the hole, go flat, and then just advance it with the traction on the opposite direction. And a bit of pressure, that's it. Okay, I'm gonna inject the rest of it. Okay, everything's done, but let's make sure everything's just smooth. Just clean the whole face again. Okay, just straight for me. Disconnect them, everything. So already this side, everything's soft. And this is almost flattened out, but if it's not completely flat, I'm just gonna give you a bit of massage. And that's all you need, it's already flat. Good. Just going to press each line to make sure everything's soft. They're all soft. Now that one's the last line that white guy did, so that's why it's slightly bulging. All you need to do is gentle pressure. Even if we don't press it, maybe by the time she gets home, it'll be flat. But she can't walk out with the bump on her head, so just make sure the client leaves the clinic looking smooth. Okay, finished.